Last week, the American Diabetes Association did something it hasn't done in 40 years. At their 86 scientific sessions in New Orleans, the ADA formally revised the standards of care. Cardiovascular and kidney risk reduction are now co-primary treatment goals, alongside glycemic control, ending decades of A1C as the dominant benchmark. If you're over 40 and managing weight, metabolic health, or hormonal change, your doctor's framework for treating you just shifted, whether they've told you yet or not. In the middle of that policy shift, Eli Lilly presented the full phase 3 data for Retatrutide. I'm Rob Lagana. I coach adults over 40 on Recovery First body recomposition. This is what ADA 2026 actually revealed about Retatrutide. Let's start with the data. Then I'll tell you what most of the coverage is missing. The pivotal trial is called TRIUMPH-1. 2,339 adults with obesity. 80 weeks randomized placebo-controlled. 3 doses tested, 4 milligrams, 9 milligrams, and 12. At 12 milligrams, the average weight loss was 28.3%. That's about 70 pounds. At 9 milligrams, 25.9%. At 4 milligrams, 19%. Placebo, 2.2%. 45% of 12 milligram participants achieved at least 30% body weight reduction, and that's the threshold historically associated with bariatric surgery. 65% dropped below the BMI threshold for obesity entirely. 1 in 3 returned to a normal BMI under 25. A subgroup with severe obesity, BMI 35 or higher, continued in an extension to 104 weeks. At 2 years, the 12 milligram arm hit an average of 30.3% body weight reduction. It's about 85 pounds. The companion trial, Transcend T2D1, was simultaneously published in The Lancet. 537 adults with type 2 diabetes, A1C reduction up 2.0%. 90% of patients reached an A1C under 7. 85% reached 6.5 or below. In TRIUMPH-1, the cardiometabolic improvements were striking. Triglycerides down 41%, non-HDL cholesterol down 24%, systolic blood pressure down 12.3, waist circumference down 9.5 inches. And 2 outcomes that most coverage is burying, both from nested basket trials within TRIUMPH-1. In 574 participants with knee osteoarthritis, pain reduced by 73%. In 243 with moderate to severe sleep apnea, severity reduced by 60%, about 36 events per hour fewer. These aren't side notes. They're the kind of outcomes that move the needle on the quality of life for adults over 40. Now, here's where I want to slow down, because the headline number, 28, 30%, that's what every podcast and every influencer is leading with right now. But, the most interesting story isn't the 12 milligram arm. It's the 4 milligram arm. At 4 milligrams, the lowest dose tested, participants lost an average of 19% body weight. That's still bariatric range efficacy. And the discontinuation rate, 4.1%, below placebo's 4.9%. Eli Lilly itself is now positioning the 4 milligram dose as the broad market option, not just a stepping stone to higher doses, because the tolerability picture flips dramatically as the dose climbs. At 12 milligrams, discontinuation is 11.3%, nearly 3 times the 4 milligram rate. The new safety signal everyone's flagging is called Dysesthesia. It's an abnormal sensation of touch or temperature. At 12 milligrams, 12.5% of participants experienced it, compared to less than 1% on placebo. It's glucogen receptor mediated, dose dependent. It peaks around week 24 and reverses on discontinuation. It's manageable, but it's real. And it's the kind of detail that gets missed when a video leads with 28% headlines. Now, what about access? Well, Lilly has not filed for an NDA. The most likely filing window is late 2026 or early 2027, and standard FDA review is 10 months. Priority review is 6. The earliest possible FDA decision is late 2027. Commercial launch, 2027 at the earliest. That means anyone selling you Retatrutide today outside a clinical trial is, selling in the gray market, not a clinical pathway. If you want the full breakdown on how Retatrutide works, the receptor mechanism, the science, that's a separate video on this channel. And the honest 2026 answer on how to access it responsibly is in another video, both linked in the description. Here's where this lands for adults over 40. The new ADA standards of care just elevated cardiovascular and kidney risk to co-primary alongside glycemic control. Retatrutide hits weight, A1C, lipids, blood pressure, waist circumference, sleep apnea, and joint pain in one trial. It's not just a weight loss drug, it's a cardiometabolic drug, which is exactly what the new framework demands. But it's still investigational, right? It still requires physician supervision. It still has dose-dependent trade-offs you'll monitor. That's why PowerSculpt partners with CloudCure for the physician-supervised pathway. We handle the routing privately on a client basis. Most programs start with training. PowerSculpt starts with recovery. Training creates a signal. Recovery creates the change. If you're trying to figure out whether Retatrutide fits in your situation and what to do in the 18 to 24 months before it's actually approved, head to the troubleshooter, link in the description. Be smart out there.